So here we are with the next day of reading comprehension, and it is being presented by me, Kamlinder Chaudhary. Okay, so let's move to the passage. So if you would have read the passage, you might have got that the read is easy. It is about the psychosomatic illness, and the first paragraph concerns itself how the West medicine has kept a difference between body and mind or the diseases related to it. Right. Now, let us move to the next paragraph. Okay. The next paragraph would say this. Okay. Psychosomatic disorders may appear purely physical, but they originate. Okay. It is telling us about how the physicians, okay, are not first, they do not recognize, okay, they do not recognize it. And if they do recognize the psychosomatic disturbance and tell the patient that it is in the mind. So no such remedy is provided or relief is provided to the patient. But there were some doctors who were along with, right? One of them was Sarno. So he has given us, right? He has given us, okay, he has given us, so he has given us, okay, Sarno is one of the handful of physicians that work collaboratively with psychoanalytically oriented psychotherapists. Okay. So what did he say about this has been written here. The paraphrasing of this, the enormity of miscarriage of medical practice may be compared to what exists if medicine refused to acknowledge the existence of bacteria and viruses. This is a really serious allegation from Sarno to the Western medicine concept. Okay, let us move to the questions. When moving to the questions, there would be certain questions in your mind, right? And the questions are not that difficult, but the options are, right? So that is why looking at the options and the questions is really important, and deciding whether to do them or not is really important. So first one, which of the following statements would the author agree with? Okay, symptoms of a disease serve no purpose once they are diagnosed. Okay, now here no purpose has been used, so we have to see whether no purpose has been given in that or not, right? Let us see. So here, okay, it has been given the symptoms, then serve no purpose, then save no purpose, right? When the symptoms are seen for what they are, okay, so this is a conditional statement. How can we make this a general statement in an option? That is wrong, right? That is wrong. And it is a distortion as well as a extreme one, right? So that we cannot choose it. Extreme general statements, right? Once they are diagnosed. He was only talking about the mental, okay, the mental or psychotic diseases, right? Or uneases, right? So he was not talking about the symptoms in general, right? So this is a great example of distortion, which you might, right? You might do away with. Second one, diseases originate in emotions that are unconscious or dissociated from consciousness. Okay. Okay. So he is again giving a general sentence in emotions that are or dissociated from consciousness. So what would you call the physical diseases? Okay. First of all, I didn't mention it, right? Psychosomatic diseases. Okay. So where does the psychosomatic, how to know the meaning of the words like psychosomatic? Psychosomatic has been given in depth in word power medicine. Okay. So that is why I have been asking you again and again to know about word power medicine. Diseases originate in emotions that are unconscious or dissociated from consciousness. So this would be a wrong statement. The word infection should probably be expunged from medical dictionaries. This is too out of scope or alien. Right. So we have to check this carefully, and this can be done quite easily. Okay. Now, the second question is with the primary contention or primary concern. Okay. These questions remain from moderate to difficult level, right? So you would have to be careful here. In 90% of those instances, there would be some easy questions too, right? But you would have to be careful in this type of questions. Okay, the first one is most physicians do not treat patients with psychosomatic disorders. Okay, that has been given, and since most has been used, it might be the answer even if it is an inference question. Second one, most patients with psychosomatic disorders do not seek medical. We were not talking about the patients, right? Physicians do not understand the mind and body are connected. Okay, we can say that. And there is such a thing as unconscious mind. We were not concerned with whether the doctors believe about the unconscious mind. And also this is a general sentence. So there were some people like Sarno who had the concerns like that. Okay, so we won't be able to choose the general statement. So this is a wrong statement, right? This is a wrong statement. So we are only left with 1 and 4. Most physicians do not fully understand the real nature of psychosomatic disorders. Okay, so the problem with these, okay, you have to go through the main idea, right? And also you can decipher between them with the tone, right? So most physicians do not fully understand. Was the passage about the understanding of the physicians? I do not think so, right? I do not think so. It was not about the understanding of the patients. First, the author told us about Western medicine. Okay, and how there is a difference between there is a difference between, okay, the body and mind, right? And both are not related. So most physicians do not understand the fact. Okay, the way the author has written about it, we are choosing between 1 and 4, remember that. Okay, the way the author between this, okay, has used Cerno's statement, if medicine refused to acknowledge the existence of bacteria and virus. Okay, perhaps the most heinous manifestation of this scientific medievalism has been the elimination of the term psychosomatic from recent editions of Diagnostic and Statistical Manual of Mental Disorders, the official publication of American Psychiatric Association. So it seems like the mistake has been deliberate on the basis of this tone, right? Not the lack of knowledge. Okay, not the lack of knowledge. Okay, let us move to the question now. Okay, so first and fourth, let us see. Okay, understand, do not fully understand. Okay, even if they understand, right? Even if they understand, right? They are not really keen to examine it or cure it, right? So this statement doesn't go with the main idea. The statement most physicians do not treat patients with psychosomatic disorders has been involves all the paragraphs, okay, the gist of all the paragraphs, and is the main idea. If you have any concern about this and questions about this, because I do not know all the questions that you might arise with, right? So you can call or connect with me on the message. Okay, now third one. Which of the following best describes the author attitude towards the Western medicine and Eastern tradition of treating illnesses? Okay, this was a difficult level question. Do not be demoralized if you have done it wrong. Okay, now let us do with this. Which of the following best describes the author's attitude towards Western medicine and Eastern tradition of treating illness? Okay, now in this one, sarcasm, he didn't use sarcasm. Okay, appreciation of Western medicine, this is opposite, right? This is alien and this is opposite. Okay, so we are only left with first and fourth. Why? Disapproval of Western medicine and admiration of Eastern tradition, right? Condescension towards Western medicine and indifference to, okay, so disapproval of Western medicine, okay, or condescension towards Western medicine. I think condescension was more of a sort of tone that he was using. Right now, and indifference to Eastern. Now, this seems to be a bit of concern here, right? Admiration of Eastern tradition. Okay. Now, let us see whether the tone reflects admiration or indifference. Okay. Let us see. Okay. So, let us see. Okay. Here it has been given, this discussion has directed how Western medicine evolved and has powerfully negative effect. Okay. No. Yeah. Here he has mentioned this about. Okay. While Eastern tradition had the wisdom to view the mind and body as coming from the same energy or source. Right. So he is telling about what Eastern tradition had done. Right. But we are not so sure that he has an appreciative regard towards Eastern tradition. Had he written some more, we would have got some idea. Right. It is more about the condescension. Okay. Condescension means nicha dikhana. Right. To show someone down. Okay. Disapproval of Western medicine. Now let us check these tones. How would disapproval be written? Okay. Disapproval would be written in a way that this is not correct. Right. But condescension. Let us see what a condescension would be. Let us see the tone. The enormity of this miscarriage of medical practice may be compared to what would exist if medical refused. Okay, let us move to the next sentence. Acknowledge the existence of bacteria and viruses. Let us move to the next sentence. Perhaps the most heinous manifestation of this scientific medievalism has been elimination of term psychomotor. Okay, so he is condescending towards, okay, he is comparing it, right, at first with the Eastern philosophy, right? And then he is making fun of it in a negative way. That is called condescension. Okay, so that is why I would go with the condescension rather than the first one. Let us have a look. Disapproval of Western medicine and admiration of Eastern tradition. I do not think that he was talking about the admiration of Eastern tradition, because only there are two reasons for this, right? First, only one sentence has been given. Okay, and many of you would get stuck on the word wisdom. Okay, so wisdom, okay, this is only about one tradition, right? The one contention on the psychosomatic, and Eastern tradition is a fairly broad term, right? It would include everything in the tradition. So fourth one is a really close one to the answer, and we can choose it. Fine. I hope this takes away all your doubts. And in case you have any doubts, please feel free to contact. Okay. So I sign off with this explanation video. Keep on doing the RCs.